Hi, my name is Kara and I'm a student pharmacist, and in this video I'll be showing you how to properly administer insulin using a syringe. So before you can actually begin your injection, you need to make sure that you have all the materials. So of course you would need your insulin, you need the syringe, you would need some alcohol pads, at least 2, a sharps disposal container to get rid of your needle after you inject the needle, and then optional is a Band-Aid just in case you want to put one on after you're done. So for this video, instead of injecting myself with insulin, I'm going to be using some salt water. But the same ideas apply. So the first step is you need to take an alcohol pad and just take one swipe across the top of the vial. While that dries, you can take the caps off of the needle, actually off of the plunger and off of the needle. Alright, and so for this example, I'm going to be using 20 units of insulin, but the amount of insulin that you need to take will be different depending on what your doctor prescribes you. In this case, I'll just do 20. So you need to pull back the plunger until the black line lines up exactly with the 20 unit mark. You'll need to fill the syringe with air, the same amount that you would be injecting yourself with insulin, so that you can equalize the pressure inside the vial and outside the vial, so that it won't make it hard to pull up the insulin when you're actually pulling the insulin into your syringe. Alright, so now that I've done this, you can just inject the needle with the bevel up at a 90-degree angle and inject the air into the vial. Now you can flip over the vial and you can pull down the syringe until you reach the 20 unit mark. And there's usually air bubbles, but this is an easy thing to fix. And it's also a good idea to get rid of air bubbles so that you don't displace some of the volume of insulin with air, because then that means you might not be getting the right amount of insulin. So to do this, you could just flick with your thumb, or whichever finger is easiest, until the air bubble escapes. Sometimes it's kind of tricky. Alright, so once you've done this, then you can flip back over the vial and pull up the needle. So after you have pulled up your 20 units of insulin, then you can temporarily, because you haven't injected it yet, you can use the scoop method and then just carefully place the needle back inside the cap while you take another alcohol pad, and then you'll want to wipe down an area of your abdomen or wherever the injection site is. Just wipe it once with alcohol. And you can use other sites besides the abdomen. However, this is the most common site. You'll just want to make sure to pick an area that is at least 2 inches outside, a 2-inch radius outside of your belly button. So while that dries, I'm going to get the needle ready. Alright, so now that you're ready to do the injection, you can take your needle and then grab the same fold of fat that you previously wiped with alcohol. Alright, and so whenever you're ready, just quickly inject on the count of 3 using a dart-like motion. A fast motion will reduce the amount of pain, if any, that you will feel. Alright, so here we go. 1, 2, 3. Let go of the fat, push the plunger down slowly, and then remove the needle. And then dispose of the needle in a sharps container, and take a cotton ball and press it right over the injection site for at least 5 seconds, just to make sure that the insulin doesn't come back out. Alright, and then optionally you can put a Band-Aid on afterward. Alright, so I can give you a few tips to prevent painful injections. The first would be you can use room temperature insulin. You don't have to use refrigerated insulin. That will just make it more painful. Also, when you're doing the injection, even though it's with a needle and that can kind of, make you a little bit scared, just try to relax your muscles. That will help prevent some of the pain. Also, it's better to use a sharp needle, because if you use a dull needle, then when you're entering the skin, it's not going to easily go in. And so you can reuse needles. However, just keep this in mind if you want to prevent a painful injection. And then the last tip would be that even though it might seem scary to do it, just inject yourself quickly, because the faster you do it, the faster you get that. And if you feel anything at all, then the faster you get it over with. And that will actually make it an easier and less painful injection. All right, I hope this has been helpful. Thank you.